The hot weather that's been affecting the western part of the state is due to arrive here in Sydney within the next couple of days. I believe it's forecast to be 39 degrees in the western suburbs on Friday and 41 degrees on Saturday. And we know from experience that those kind of temperatures can have quite a significant impact on people's health. But more than that, we've also believed that this summer is going to be quite a bit hotter than the last couple of summers. So this is just a really opportune time for us to remind people that heat can be a health issue, but also that there are some simple things that they can do to minimise their risk during hot weather. So the first thing is how people can minimise their own risk. The most important, there are two key things for people to do. The first is to drink plenty of water, and I know it sounds simple, but people, and especially elderly people, often forget. And it's a good idea to think about drinking plenty of water and fill up a jug of water or a couple of bottles now and put them in your fridge, and try and remember to drink them over the course of the next day, and do the same thing tomorrow in preparation for Saturday. Another important message is to think about how you're going to keep cool over the course of the coming few days. It's usually only hot after about 11 o'clock in the morning, so plan your day around that. Avoid going out in the middle of the day, and if you're intending to do any physical activity, try and do that first thing in the morning before it gets hot. If you had a game of golf or were planning to mow the lawn on Saturday afternoon, think about postponing that and doing it first thing in the morning. Another important way to keep cool is using air conditioning. If you have your own air conditioner, make sure it's working now and use it over the next couple of days. If you're ever going to use your air conditioning, now is the time. But also, if you don't have air conditioning, try and get to a cool place such as a shopping centre, the movie theatre or a library. But what's really important during this period of hot weather is that even if you think you're going to be okay, there may well be other people close to you, or friends, relatives, who are more vulnerable, who may be struggling. So it's really important now to get in touch with those people and think about offering them some help. And people who are vulnerable in heat waves are particularly the elderly, those over the age of 75, people with chronic diseases, so those are diseases such as heart disease, asthma, other respiratory conditions like emphysema and diabetes. People who live on their own are also especially vulnerable during these periods of hot weather, and people who have to work outdoors as well during the hottest parts of the day. So we'd really like to encourage people now to get in touch with those people, telephone them or try and visit if you can, and offer them some support and practical advice. So put a jug of cold water in your grandmother's fridge and remind her to drink it over the course of the next couple of days. Make sure her air conditioning is working and encourage her to use it. I know from my own experience that my elderly relatives often drink nothing but tea, and I'll be encouraging them in the afternoon to substitute their cup of tea for a couple of glasses of cold water. I also know that they try not to use their air conditioning unless they have guests around, and I'll be encouraging them that if they're ever going to use their air conditioning, the next couple of days is the time to do it. And one final thing, if people don't have air conditioning, and many people don't as well, offer to take them to a cool place such as a shopping centre, a movie theatre or the library. Now I just wanted to say a few words about heat-related illness itself. When we think of heat-related illness, most people think of heat stroke, and that's certainly an important condition, but even in this hot weather it's quite rare. And what we find is that heat places a great deal of strain on the body, and it actually increases the rate of all types of illness. So we tend to see increases in the rate of heart attacks, increases in the rate of asthma, more falls than usual, and so for a whole range of conditions. And people just need to be aware that heat can cause a whole range of things, and they need to be especially vigilant for those things and have a low threshold for getting help, calling their GP or the ambulance if that's appropriate. So just to say once again, whilst the next few days are certainly going to be hot, we're also expecting this summer to be significantly hotter than the last couple of summers. So we'd just like to emphasise that people need to start preparing themselves now, having a bit of a plan for how they're going to cope with the heat, keeping an eye on the forecast for the whole summer, and if it is going to be 37 degrees, think about how you might avoid that heat. So cancel your game of lawn bowls on the really hot days, put them off until it cools down again. And one final thing is that if you need any further information, the New South Wales Health has a Beat the Heat website, which has a lot of useful resources about heat and your health and the things that you can do to minimise heat-related illness.